My name is Mariah Miller, and I will be doing my disease on Pyometra. Pyometra happens when levels of progesterone start increasing after ovulation. This results in hyperplasia and hypertrophy in the endometrial glands of the uterus. Hyperplasia is an enlargement of an organ or tissue caused by an increase in the rate of reproduction cells. And hypertrophy is an enlargement of an organ or tissue from the increase in size on its cells. RVTs are involved by helping a patient with pyometra is to monitor patients while on fluids, set up a surgery room when necessary, monitor patients during surgery while under anesthesia, recover patient after surgery and continue monitoring patients while recovering, get medication ready if patient will be going home, inform owner how to take care of their pet while the pet is still recovering. Pyometra is a secondary infection that's caused by a hormonal change in the female's reproductive tract. Clinical signs are vulvar discharge, abdominal enlargement, vomiting, lethargic, polyuria or polydipsia, dehydration, and azotemia. Pyometra mainly affects intact young to middle-aged canines, mostly common in older dogs, usually occurs 2 to 8 weeks after the last estrus. After many years of estrus cycles without pregnancy, the uterine wall undergoes the changes that promotes pyometra. To diagnose pyometra, first a radiograph of the abdominal would be taken, which will indicate an enlarged uterus, and this will also rule out a pregnancy. An ultrasound also could be used to examine the abdominal area to distinguish between fluid and pregnancy. CBC, serum chemistry, and a urinalysis test will be wanted of the DVM. A vaginal cytology test can also be done as well, depending on what the DVM asks for. Ovariohysterectomy is the preferred treatment for pyometra. Dehydration and azotemia must be corrected before surgery, so fluids will be done first. If the animal is used for breeding, the owner does have the decision to go a different route for treatment. This includes fluid subcutaneously, 1 to 2 times daily for 3 to 5 days or until uterus is empty. Antibiotics will also be given until culture results come back from laboratory. Prognosis, treating an open cervix, 75 to 90%. Treating a closed cervix, 25 to 40%. Reoccurrence of happening again is 50 to 75%. And subsequent successful breeding chances is 50 to 75%. Prevention of pyometra is ovariohysterectomy, which is spaying of the female canine. Overall costs will depend on how severe pyometra is. Fluid therapy can range from about $60 to $300. Antibiotics can range from about $60 to $150. And surgery can be anywhere from $1,200 to $3,000. Thank you so much for taking the time out of your day to watch my presentation. I hope you enjoyed watching it as much as I did making it.